Hey guys, happy Friday to you. Today we're going to start going over a few of the very straightforward core exercises that I utilize with myself and a lot of my patients that are recovering from back issues and herniated and bulging disc, sciatica, that kind of thing. What happens with a lot of patients is they're trying to strengthen their core. And when they're trying to strengthen their core, what they're doing is a lot of crunches, or they're using the machines at the gym that are causing their lower back to go into this forward flexion position. So from a side position, if we're just here, would be neutral. If we go into backwards bending, that's extension. And anytime we bend forward, we call that flexion. Flexion here and there is not in of itself a bad thing. However, doing many flexion motions throughout the day, and especially when we're trying to strengthen abdominal muscles, is not generally the best. Sure, it can provide you a six-pack, but at what cost? It definitely is going to have cost involved with that. So here's what happens with the lower back. When you go into a flexion position, right? So we have a bone here, and then here's the disc. So if we were to take this out of my lower back, it would be in this position from the side. And so what happens when we go into a flexion position, what it does is it causes the front of the bones to squish down and the back of the bones to kind of widen a little bit. However, when the back of the bones widen, the reason why they're widening is because the disc, which is in between, it's having a tendency to push to the back. And we don't necessarily want that, because over time, kind of like a tire on a car or a truck, is the more that we wear that out, the more the tendency it is to kind of blow that tire out, so to speak, and blow that disc out. So the disc eventually, if we continue to do more and more and more and more of these, and especially doing it over and over and over again in a fatigue state, kind of at the end of a workout, for example, that's going to put a lot of pressure on that disc, and eventually that disc can push on out. And when it pushes out like that, we call that a disc herniation or a protrusion, and that can put pressure on the nerve and unfortunately cause a fairly significant injury and a lot of pain. So there's some alternatives to doing that. A lot of times with patients is once they understand that when they go into a lot of flexion motions, and that puts a lot of pressure on the spine, then they understand that and it makes sense to them. And so hopefully that demonstration makes sense to you as well. So we'll go over all four of those exercises. Right now we're just gonna go over exercise number one of the four. So the first one that I like to use with patients is because it's fairly straightforward. This is called the side bridge. So the setup for a side bridge is going to be your knees starting to this position. This back here on the side, we want to have this straight. We don't want to sag, right? When we sag, that puts the extra pressure on the spine, which we don't necessarily want. And then we want that foot upright, that foot flat, if that makes sense. So start here with that knee and then the foot flat, yeah? Now, in this position here, it's a very straightforward move. We're just going to raise that hip off of the table. That's all I'm doing, raising the hip. Now when I'm doing that, all of these muscles should automatically engage, okay? A couple of keys when we're doing that is, number one, I want to make sure I do not hold my breath. If we hold our breath, that increases the pressure inside the spine, and that can lead towards more problems, okay? Number two, when we're doing this, is we want to make sure that the muscles are actually engaged, okay? Now, in this particular exercise, it's almost no option that those muscles, they're going to be engaged. So we're going to raise on up, we're going to breathe normal. We're just going to hold for about 5 to 10 seconds, okay? And then we're going to kind of bring it down, reset. Remember, when we come down into this position, try not to sag, okay? The other things that sometimes I'll see is a patient's got their elbow way out here, and that's putting a lot of stress on that shoulder joint, which we don't necessarily want. We don't want to create extra problems. So more or less, we want that shoulder the elbow right over the shoulder in a straight position here. Again, raising on up, we're gonna hold 5 to 10 seconds, trying to keep this head in a fairly neutral position. We don't wanna way far forward in this position, and then we're gonna come down. And of course, we do both sides, so flipping over to the other side. And straightforward with this. We don't need to do hundreds and hundreds of repetitions with this. This is 5 to 10 second holds, 5 to 10 repetitions, okay? 5 to 10 second holds, 5 to 10 repetitions, okay? So same thing, we're in this position, we're here, we're gonna take this knee, we're gonna put this foot here, and then we're gonna be right in this position, okay? So raise it on up, making sure we're not holding our breath, head's in a neutral position, holding about 5 seconds, normal breathing, and come on down, okay? 5 to 10 repetitions. That makes sense? So try that out, give it a roll, see how that goes. I'll be back with some more posts for the other exercises. You do this daily. Oh, and another point is, if you can, always try to do the core strengthening before the workout, right? Don't do it at the end when you're all fatigued and your form's gonna be poor. We wanna do it before, because we want those muscles working to try to protect that lower back and prevent that disc, again, from wanting to compress and push on down, okay? Because we don't want that. Disc herniations and bulges aren't fun, okay? All right, talk to you soon, bye.